Today, Mackenzie, Savannah, and Karina will teach you about vicarious trauma. What is vicarious trauma? Definition of vicarious trauma: transformation in the inner experience of a therapist or worker that comes about as a result of empathetic engagement with client's trauma material. Burnout, conceptualized as a defensive response to prolonged occupational exposure to demanding interpersonal situations that produce psychological strain and provide inadequate support. Compassion fatigue can be described as the cost for caring. Workers are affected through direct and secondary exposure, and it also refers to the profound emotional and physical erosion that takes place when helpers are unable to refuel and redeem. On the next couple of slides, you will find examples of the definitions that were explained previously. If my job as an administrative assistant to a parole officer is to read the files of violent sex offenders, I may be secondarily traumatized and deeply disturbed by the content of what I've read. This may in turn affect my sex life, my feelings of safety for my children, or my ability to watch TV. However, I may not necessarily feel too tired to talk to a friend who is going through a difficult time at home, and I may not find that this has caused me to feel deeply exhausted in my interaction with colleagues, but then again, I may experience all of the above. If I work as a nurse in palliative care, helping patients who are dying of cancer, I may feel incredibly drained, fatigued, unable to give any more, unable to stop thinking about my patients when I go home. I may also find that I have become very preoccupied by death, dying, and end-of-life issues, which over time may affect my worldview and beliefs about aging, cancer, or similar issues. Compassion fatigue and vicarious trauma are much more complicated than just being tired and overworked. They're often caused by a conflict between our deepest values and the work that we are required to do, a phenomenon which is called moral distress. Who does vicarious trauma affect? Vicarious trauma affects doctors, nurses, social workers, therapists, paramedics, and police. It's not limited to this list. Risk factors include current life circumstances, your history, coping style, and your personality type. Signs and symptoms: emotional numbing, social withdrawal, work-related nightmares, feelings of despair and hopelessness, loss of sense of spirituality, negative view, reduced sense of respect, loss of enjoyment, no time or energy for yourself, can't discuss with family or friends, and difficulty trusting others. Micro-level impact. As professionals, we can become so invested in our role, the challenge becomes separating work life from our personal life. When there's a lack of balance, there is personal cost, which, as shown in previous slides, can lead negatively to our personal relationship. Micro-meso level impact. We may also be unable to meet the emotional and professional demands within practice. We may become emotionally exhausted from chronic demands and expectations of clients and/or from high caseloads. Micro-meso continued. Depersonalization and detachment from client situations or workplace can also occur, or feel inadequate when a client does not respond to treatment. A pre-existing disorder or personal trauma history can heighten negative feelings or behaviors. Within the organization, there could be many bureaucratic constraints which need to be navigated or changed, lack of proper supervision and adequate resources for clients, and lack of support from colleagues. Micro-meso-macro continued. Also, whether an agency acceptor does not accept VT, CTS, and CF as a normal reaction to client's trauma, one way is supportive and another is negative. A quote from Eleanor Brown: "Rest and self-care are important. When you take time to replenish your spirit, it allows you to serve others from the overflow. You cannot serve from an empty vessel."
Created using Powtoon.